In the past 2 years, scientists have developed a fairly solid basis for understanding warfarin metabolism and the genetic variants that affect warfarin metabolism and its mechanism of action. However, there really have been no studies that demonstrate its use in clinical practice. All of the studies have been basic science showing the effect, but nobody's demonstrated that it makes a difference in a patient. Approximately 2 years, Mayo Clinic and a pharmaceutical benefits management company, Medco Health Solutions, decided to work together to perform such a study. Starting in about 2008, we recruited 900 patients who were receiving their first prescription for warfarin, and we asked their permission to track their health care utilization for 6 months. The patients that gave us this permission, we then went to their physicians and asked their physicians for permission to provide them the genotype test and some guidance as to what to do with the results. In the background, we were tracking their healthcare utilization. Healthcare utilization means how many times did they visit a physician? Did they have to go to the hospital for any reason? Were they in the hospital for a warfarin-related adverse event, like a bleeding event or like a stroke event? All of that information was accumulated over the 6-month time period from the day they started on warfarin. Subsequent or simultaneous with that, we were evaluating another 2,500 patients who were prescribed warfarin for similar reasons as our study group, but who were not provided the warfarin sensitivity genotype test. When we evaluated the outcome of the data at the end, we found that the patients who were treated with warfarin, where their dosing was adjusted for their genotype, those patients had a 35% lesser frequency of hospitalization. So the patients who were normally treated with warfarin without knowledge of their genotype had a 35% higher incidence of hospitalizations. And these hospitalizations occurred because some of them had some bleeding problems. Some of them may have had strokes, but there were other causes also counted in there. Here is a laboratory test now that allows patients to go through their routine therapy with warfarin anticoagulation that keeps a significant number of them from having a hospitalization event. And so that's why we want to inform the public of this test. In early February of 2010, based on knowledge of our findings, as well as a number of other studies that have come out in the past 2 or 3 years on this, the FDA changed the label on warfarin to suggest that warfarin sensitivity genotyping is advantageous, and actually came out with a set of guidelines about how dose adjustments may be implemented to facilitate the benefit that this particular test provides to the patient and the treating physician and to the healthcare system.